Good afternoon. I am Dr. Yogesh Jain. I am an ENT surgeon working in Delhi for the past about 25, 30 years. We've been doing a lot of work on hearing impairment uh, and been associated with Doc Ginny ever since it started, which is, I think, about 2 to 3 years back. Right. So let's talk about hearing loss and hearing issues. All right. By far, the commonest age group would be the elderly. But that does not mean that the rest of the population will not have hearing loss. We will see a large cohort in the very young babies, uh, a slightly smaller cohort in the middle age, but the biggest, by far the biggest group would be the older people. Okay, so that will depend on what kind of a hearing loss they have. So we have, broadly speaking, we have two types of hearing loss. One is known as a conductive hearing loss. The other is known as a sensory neural hearing loss. Conductive hearing loss, as the name implies, means that there is a loss of conduction of the sound to the nerve. And sensory neural hearing loss, as the name again implies, that there is a problem with the nerve and the brain part of the hearing. So depending on what the loss is, what kind of loss it is, the treatment would depend on that. So for conductive hearing loss, there is medication available, there is surgery available, and there are hearing aids available. Most of conductive hearing loss is reversible, either mostly by surgery, less often by medication, and very uncommonly by hearing aids. The sensory neural or the nerve type of hearing loss is almost always reversible or treated or managed by hearing aids. There are generally not many surgeries or medications available for nerve hearing loss. Unless the patient comes to us very early, then we can try some medications. But the commonest treatment that we give in a nerve hearing loss would be a hearing aid. So cochlear implants are essentially devices which are implanted in the patient's ear. They're used for severe to profound hearing loss. When hearing aids don't work. So it consists of a device, two devices actually, one of which is implanted inside or operated and implanted inside the patient's ear. And it is supposed to bypass the inner ear and send the sound directly to the nerve. So it's very, very useful for babies who are born, who are colloquially or traditionally known as deaf and dumb. So these babies are dumb or they're mute because they are deaf and they haven't learned how to speak, and they cannot learn how to speak because they can't hear. So it was initially started, these implants were initially developed for these babies, and they have worked beautifully. I mean, we probably, the world over, probably more than a few million implants have been used. They've been widely successful. Probably the only machine which has succeeded in interfacing with the nervous system of the body so far. Of course, the indications have increased to include all patients who cannot be benefited from a traditional hearing. So why the timing is important is because especially in children, in babies who are born deaf, who are born hearing impaired, their brain would eventually learn how to speak once they start to hear. But this learning ability will disappear by the age of anything between 5 to 10 years. So it is essential to utilize this time and make the baby hear before that ability disappears. If we are too late, the baby will learn how to hear. He will start hearing, but he will not learn how to speak. That is why the timing is important. That's a difficult one because much of the hesitation in hearing aids is essentially the stigma attached to it. That a person all over the world, not just in India, probably thinks that this is a sign of age or old age, right? So that, of course, will need to be addressed by a variety of people, including the patient himself, but by his family, by his friends, by the community, by society as a whole. So that's one. Second, they need to also learn, they and their caretakers, their family members, their friends, their well wishers, need to understand that hearing loss is probably the second commonest preventable cause of dementia in the elderly. So I'll just give you a little statistic. If you have, so we divide hearing loss into three categories: mild, moderate, and severe. So if you have mild hearing loss above the age of 60, the chances that you will develop dementia is 2 times more than the person who doesn't have a hearing loss. If you have moderate hearing loss, the chances are threefold. And if you have severe hearing loss, the chances are 5 times. So it's actually very, very important that they embrace hearing aids if they have a hearing loss and they use it well. Right. So they need to be made aware that this is important.